Yeah. So, um, you know, I, I've been loving ozone therapy, and so do a lot of practitioners and a lot of patients. A lot of people are using it at home, with the ozonated water, with the ozonated, we're doing, rectal, vaginal, or other type of, ear insufflation. So there's so much to talk about for ozone because there's tremendous interest. I want to ask you about your journey with ozone. How did you even know about it and get interested in it? And not to mention bringing it to the US, and as you are considered the father of ozone therapy in the US. So maybe you can share a little bit of your journey.
Well, I think maybe I'll just give credit to the whole rest of the world. Ozone therapy has been going on for a really long time. It's not a newcomer. I know for a lot of people, maybe especially doctors, they not aware of ozone therapy, but it's been in practice for over 150 years. And it was first discovered back in the 1700s. And then later on in the 1800s, it started using it as a disinfectant. And just so listeners understand this, ozone is a form of oxygen. It's got nothing to do with pollution. It's true that in pollution there is ozone, but ozone's got nothing to do with pollution per se. It's just pure oxygen. The difference between ozone and the regular oxygen that we breathe is that ozone has 3 oxygen atoms, whereas the normal oxygen that we breathe has 2 oxygen atoms. That third oxygen atom is what accounts for the ozone's unique properties. It makes it a highly more reactive substance than regular oxygen. So as we're going through this conversation this morning, when we talk about administering ozone into patients, it's a pure form of oxygen, but you'll get things happening when you administer ozone to a patient that you would never get by administering just normal oxygen.
Hmm.
So anyhow, back in the early 80s, I heard about this. And in Europe, they were doing it, had been doing it ever since, the early 1900s. Interestingly enough, a man that people will have heard of for sure by the name of Tesla was the genius that in the early 1900s actually came up with the first ozone equipment designed specifically for medical purposes. So it goes way back, is my point. And so back in the early 80s, I went to Germany to learn about it. And I was just absolutely astounded by what I heard and what we can talk about today. It's almost hard to believe.
What did you see in Germany that astounded you?
Well, first of all, was the history. The history is phenomenal. And it goes back to, so many geniuses that we've all heard about. And you start to wonder, how did this thing get overlooked? And we could talk a little bit about what the answer to that might be. But anyhow, that's one thing that astounded me. The other thing that astounded me is the broad application base. You can put ozone into any body part. I mean, literally any body part. The only part of the body I have not injected ozone into would be the brain. Other than that, I have put it in every possible place in the human body. It's very applicable that way. You can apply it in to the bloodstream. You can use it systemically, and that's what I learned. It was a 4-day conference, and it was an eye opener. And I came back home here to the U.S. and started using it. And what I started to realize, well, I'll tell you a story. So here's how this worked out. So many things that happen to doctors, we accidentally learn about, for doctors and scientists. But anyhow, so one of the things they taught me in Germany was that rheumatoid arthritis is caused by a bacteria. No, I think most rheumatologists are aware of this connection, but they said what you can do is, if you've got a rheumatoid patient with a very swollen rheumatoid knee, that's because there's a germ in there, and you can inject ozone in, because ozone kills germs, 100%, kills everything, germs, viruses, whatever. And you can inject that in there, you kill the germ, and the knee gets better. So I thought, okay, fine. Well, as fate would have it, when I got back to the US, sure enough, some woman walks into the office with rheumatoid arthritis, some very painful swollen knees. And I told her, look, I just learned this new thing. Let's shoot some ozone into the knee. And we did that. And she comes back in a couple of weeks and, oh, yeah, my knee's like way better.
Hmm.
And then, but the real tip off was about 4 or 5 weeks later, her next door neighbor comes in and she says, I want you to inject my knee like you did so-and-so. And I said, yeah, but she had rheumatoid. You don't have rheumatoid. You have what's called degenerative knee. You have arthritic, it's all busted up type knee. You don't have rheumatoid. And so I don't know that ozone's going to do you any good at all. And I said, in fact, maybe it'll even hurt you. I really don't know. This is uncharted territory. And so then she says to me, she's like, look, just inject my knee. I don't care if it works. I don't care if it makes me worse. Because the point is, they want me to replace my whole knee. They want me to go into surgery and replace the whole knee. So I got nothing to lose. So I said, okay, so we'll try it out. So darn if it didn't work. So then my eyes were open. I said, what the heck is going on here? You've got a knee that's degenerated and the cartilage is wasted and the ligaments inside the knees are damaged. It's full of fluid. It's got blood in there. The woman can hardly walk. And all of a sudden she gets better. What the heck happened?
Mm-hmm.
And that was back in like the mid 80s. And that started me on this journey to kind of learn what was going on. And we maybe could talk a little bit about that. But that's how I first started to realize, you know what? This ozone thing causes tissues to heal. Later on, I learned it also takes away pain. So even if you have a condition, for example, that's not correctable, for example, not long ago, I had a woman walk in the office with very bad neck pain, but she had quite a few surgeries to her neck. And the neck was actually deformed from all the surgeries and the fusions and such. And I told her, look, it's impossible for me to correct this, but I can take away the pain at least, which is, well, as far as she's concerned, she doesn't care what the x-ray looks like. She just says, I'm in pain. So take the pain away, I'm okay. And sure enough, that's what happens. So ozone takes away pain and it regenerates joints. And that's a huge thing.